Okay, welcome everybody. Welcome to this round of Take 20 on the state legislative oral health trends with Kendall Spear from NCSL. So before we get started, I just have a few housekeeping items. This presentation is being recorded and will later be posted on Open's online community at communities.openoralhealth.org. I will share that link in the chat. For those of you new to Open, please follow the link to request a login. You can gain access to all Open resources, policy alerts, and network-wide updates there. Please do remain on mute, and if you have any questions, please pop them in the chat, and we'll have time for Q&A at the end. And now I'll go ahead and turn it over to Kendall.
Good morning or good afternoon, everyone. I am going to share my screen. I have a few slides. All right, does that work for everybody? Okay. Thank you so much for inviting me today. My name is Kendall Spear, and I'm a policy specialist at the National Conference of State Legislatures. Today, I am going to give you a brief overview of what we do at NCSL because we are a pretty unique organization. Then I will share a few of our resources at NCSL on oral health, and then I will follow up with a few legislative trends and then have time for a little bit of Q&A. About NCSL, we are the bipartisan membership organization for all state legislators and legislative staff in all 50 states, the District of Columbia, and the U.S. territories. That includes all 7,386 legislators and about 30,000 legislative staff. Our goals are to improve the quality and effectiveness of state legislatures, foster cooperation, and facilitate the exchange of information among legislatures, promote policy innovation among legislatures, and ensure that states, the District of Columbia, and the territories have a strong, cohesive voice in the federal system. How do we do this? We do this primarily through 5 different ways. The first area is through policy research, and this is the area at NCSL where my portfolio lies. NCSL provides trusted, nonpartisan policy research and analysis. We also connect legislators and legislative staff with each other and with experts who may be able to go to a state legislature and provide testimony or expertise. NCSL also delivers training tailored specifically for legislators and legislative staff. NCSL also has a small team in DC and advocates on behalf of states on Capitol Hill. And lastly, this is my favorite part of NCSL, but we hold these really great meetings where we can bring together legislators and legislative staff to exchange and have discussions of information. We like to joke at NCSL, if you've seen one legislature, you've really only seen one legislature because they are so different. As you can see on the map, there really is a large difference in the way that state legislatures are made up. They sometimes differ in the size of the legislature. They vary in the amount of seats from 13 in DC to over 424 in New Hampshire. They also differ in the number of constituents per legislator. Legislators also have different capacity. They may work full-time as a legislator, or they may have a full-time job outside of the legislature. We have legislators who are farmers, business owners, healthcare professionals, etc. They may also differ on the amount of staff that they have. They may have a large staff or they may have a small staff. So I would recommend, if you are working with a state legislature, to go onto their website, learn about the committees, and really get to know what the legislators in your state, what their everyday job is, or if they work full-time as a legislator. NCSL loves trivia, so I thought it would be really fun to just do a quick trivia question. How many bills are introduced on average each legislative session? And I'll give you a moment to put your answers into the chat. Okay, the answer is more than 150,000 bills are introduced each legislative session, and about 30,000 of those are enacted. So you may be wondering, how does NCSL track all of these bills? Because that is a lot of information, and it is. So I'm going to share 3 resources. 2 are currently publicly available to all of you, and then 1 we will be releasing very shortly. So I'm going to dive into those resources now. NCSL has a lot of legislative databases. Today, I'm just going to focus on the ones that have to do with oral health resources. But if you go onto our website, we have legislative databases basically on almost every topic that legislators may be interested in. They may be interested in one of our election databases or one of our education databases. So if your work touches those other areas, I would recommend going onto our website. The first resource I'm going to share is our Maternal and Child Health Legislative Database. And one of my colleagues is going to throw the link to that in the chat. Our Maternal and Child Health Legislative Database tracks enacted legislation from 2017 until present, and we currently update that bi-weekly. We track 14 different topic areas that have to do with maternal and child health, but the ones that might be the most useful to you are the oral health and pregnancy tag and the children's oral health tag. As you can see, or if you have it on your screen, we can filter down this legislation by state, by topic area, by bill number, if you know the bill number, or you can use the keyword search to be able to type in legislation that you're interested in. So you might be interested in dental hygienists practicing in a school-based setting. So you can just type in hygienist or schools, and that legislation will come up. And so far, since the beginning of this database, we have tracked 112 bills in the oral health and pregnancy and the children's oral health tags. The next resource I'm going to share is our Scope of Practice Legislative Database. And again, that link will be in the chat. As you can see, if you go to that resource, it looks very similar to the maternal and child health database that I just shared. But this one includes both introduced legislation and also enacted legislation. In that database, we track more than 25 topic areas, including dental hygienists and dental therapists. And since that database started, we have tracked 290 bills on oral health topics in 44 states. Our Scope of Practice webpage was just given a facelift, so you are really seeing the updated webpage, which is really exciting. This Scope of Practice webpage goes hand in hand with the legislative database, but as you can see on the map on the left, it shows a 50-state scan on a variety of health profession areas, including oral health providers. We have a 50-state scan on states that permit the practice of teledentistry, states that permit dental therapists, and a 50-state scan on dental hygienists with direct access. And our last resource I am going to share is not yet publicly available, so you guys are really getting the inside scoop here. It is the Health Workforce Database, and it will be coming out in the next few weeks. Our members are extremely interested in the health workforce, and we're really asking for a database to look at all health workforce legislation. So this workforce database will track a variety of healthcare professionals in the behavioral health space, primary care space, and also the oral health space. It will look at not only scope of practice bills, but also licensure and certification, scope of practice, recruitment and retention, and education and training. And so far, in our private tracking, we have tracked at least 39 bills related to dentists, dental hygienists, dental assistants, and dental therapists. And again, that resource will be up soon, and I will make sure to share it on the open forum. And I also have a link at the end of the presentation where you can sign up for one of our listservs, which will shoot out when this is publicly available. So I use all of these resources to track legislative trends. And what I've been seeing recently is there are the legislation falls into three main buckets: insurance and payment reforms, oral health workforce, and children's oral health. Focusing on insurance and payment reforms to start off, we have seen states authorize their state's Medicaid plans to include dental care in their benefit, and also to increase the poverty threshold to include more people in their oral health benefit. We have also seen states increase their Medicaid dental reimbursement rate in order to get more providers to take on Medicaid patients. And lastly, at least 9 states in recent sessions have introduced legislation on dental loss ratios. So I imagine that will be or continue to be a legislative trend. As mentioned earlier, workforce is a huge area of interest for our members, and we are also seeing that in legislation. We see states invest financially in expanding dental programs at colleges to train more dental hygienists, dental assistants, and dental therapists, and also investing money to expand the class sizes for their dental schools. And also states invest money into their loan repayment programs for dental hygienists and dentists. We have also seen several states enter into interstate compacts for their dental hygienists and their dentists. A few more workforce strategies. We have seen states try and license new types of providers, including dental therapists, and to create the licensing and regulatory structure for those individuals. We have also seen states expand the scope of practice for dental hygienists to work in certain schools or community-based settings. Lastly, the main legislative trend that we have seen is around children's oral health. This can look like creating a grant program to increase access to school-based healthcare, including oral health. Iowa now permits dental assistants to work in school-based settings and to apply a dental sealant onto children's teeth. And we have also seen states require or fund a oral health screening for students before entering into certain years of schooling. These are a few of my other related NCSL resources on oral health. We have some magazine articles, a webinar on school-based oral health, a few briefs, including one on rural healthcare, and many other resources. I wanted to finish up today's presentation with just a few strategies for effective communication with policymakers that you can consider if you are communicating with policymakers. You can make sure that you understand the key legislators in your state by identifying the key committees and committee chairs about the legislation that you are discussing. And don't forget that legislative staff are there as well, and they are a great resource. You can also tailor your communications by creating reports that have a one-page summary and avoiding technical jargon. Provide several policy options, and make sure to always note limitations and uncertainties. And lastly, be aware that to frame your message. Um, Legislators enjoy hearing what other states are doing, including policy successes in other states, so you can provide examples. You can also let a legislator know how these issues will affect their specific constituents. And legislators also like to know the return on investment of their recommendations or of your recommendations. Lastly, stay in touch. As I mentioned, we do have several listservs. So if you click on this link, it will be taken to a listserv page where you can join our Health and Human Services listserv, where we will also share when we release that new workforce database, and you can kind of keep up with all of our resources on oral health and all health and human services topics as they come out. Thank you so much, and I'm very happy to take any questions that you have.
So thanks so much, Kendall. I see we have a few questions that are coming in. So is NCSL a reporting resource organization only? For example, does NCSL work with the Council of State Governments on helping with healthcare initiatives?
We do. We have many partners at all different levels of government that we work with and share information between. I hope that answers your question, including CSG.
Great. Will your workforce study look at which providers take Medicaid and how much? Also look at if the provider is active seeing patients. Some providers just keep their license active but don't see patients, and also how many.
Thank you. So it won't be a study. It will just be a legislative database where we track legislation. So we won't be doing any study or coming out with any results or anything like that. Thank you.
Yes, and there is a call for the link to go into the chat that was in the slides if you have that handy, but I will make sure that those are all shared with the recording and the follow-up if that's not handy. And I see that Tammy shared your contact.
Yes, thank you, Kelly. That is the link. And if you go to the Health and Human Services listserv, that's the one that will share all of these types of resources that we come out with.
There has been quite a call for slides and additional availability of the recording. I do also want to share another resource in terms of state trends, ability to take action. This is from our partners at Families USA in support of improving oral health coverage in Medicare. So just dropping that into the chat. But feel free to keep the questions coming. And if anybody wants to come off mute, we're getting a lot of kudos. And I will also drop the evaluation into the chat if folks have a couple of minutes to fill that out for today. That'll only take just a moment, but
I'll also say that I am always looking to connect with more people in this space. So my email is there. Please reach out if you'd like to share any resources that you have. I'm always looking to learn and expand my knowledge in this area.
great. And if nobody else has a question, I will say for the open annual meeting, it's coming up October 22nd through the 24th. And I think the work that you're doing, especially seeing that coming out in September, the workforce trends, I think if possible, I would love to have you come back and join us for a more detailed, some kind of presentation if that's possible.
Yeah, I'd love to learn more about that.
Okay, great. Yeah, well, I know we're planning on some roundtables and some interactive ways to kind of get in touch with folks and connect. So we would love to have you. And that's also an excellent plug for all of you for the annual meeting coming up. The registration link should be shared early next week through Open Communities and through your email. So be on the lookout for that. I do want to just say thank you so much, Kendall, for everything, and we'll be sharing this back. And any last minute thoughts?
I don't think so, but I will share my PowerPoint with you so you have that and you can share with everyone.
Okay, great. Well, thank you all so much for joining. You will definitely get her contact, the slides, and the recording to follow. So have a great day, everybody.
Thank you. Bye, everyone.